All right, good morning. Feels like it's been so long. Doesn't anyone else feel that way? Like it's been a whole week and then I get to tell you to have another good weekend today. So feels like it's been a long time, but it's nice to see you all. Anyone watch football this weekend? It was a great weekend of football. Right? Well, there's only a few left. I'm starting to get sad, right? But then we get into baseball, so I'll be okay. I got really sick over the weekend. So thankfully, knock on something. We'll talk about superstitions eventually. I'm feeling a little bit better today, which is good. I get sinus infections all the time. I don't know if anyone else gets those, but so much fun, right? Nice way to spend a long weekend. So I hope you had a nice restful long weekend. We'll jump back into where we were last time. We'll keep going with talking about chapter 1. Really quickly here, anyone remember? Somebody give me one of the D's of abnormality. Anyone that you can think of? Yeah. Deviance. Okay, what's another one? Dysfunction. Yeah. It's close to dysfunction, right? Yeah. Distress. Okay. Duration, and then there's one more. Yeah. Danger. Excellent, right? So we spent a lot of time talking about those D's last time, right? And we'll get through the rest of the chapter today, but remember that these aren't like diagnostic indicators, right? So like if somebody goes in to see a psychologist, we're not going to look at these 5 Ds, but these 5 Ds might be an indicator that you might need to go see somebody, or there might be something else going on. So they're kind of like the Ds of abnormality, but they're not necessarily symptoms or anything like that of disorders, which we'll talk more about when we get there in a couple of weeks. So what we'll move to today is looking a little bit more at how we have viewed abnormality in the past. And I think I mentioned this last time, but our history of how we've treated mental illness is really shameful. And the reason for that is we had no idea what it was. We had no idea how to treat it, right? And so we did some pretty awful, dangerous, just bizarre things over the years. And if any of you have watched any shows highlighting older periods of time with psychology, they just show so much of this stuff and it's wild. But we'll talk about some of the kind of viewpoints as we move through time to get to where we are today. And if we go back really as far as we have any kind of documented history, the early societies thought that any kind of abnormal behavior, so odd behavior, odd functioning, odd thoughts or perceptions, was the work of evil spirits or magical beings. So literally possession, right? So when we go all the way back, any kind of mental illness was thought to be the result of demonic possession, right? Or evil spirits. And so the way to treat that was to get the evil spirit out of the body, right? To basically do one of two things, either a medical procedure called trephination, or a more of a religious procedure called an exorcism. And then these things, the trephinations aren't practiced anymore, but exorcisms are still practiced periodically, a little bit differently than they were in the past. But a trephination is what's happening in that image up there. They would literally go in and cut away circular sections of the skull to make holes for the demons to exit the body. Now, as you can probably guess, a lot of people died in these procedures or were severely brain damaged. And so what you got was you had people who were agitated and yelling and screaming and very upset. And then all of a sudden they went very calm and docile. And we're like, oh, it's a success. We treated them. They were probably brain dead as a result of the procedure. But the idea was to take a blunt instrument or some kind of saw and literally either poke holes or create holes in the skull to allow the demons to escape. Very unsuccessful procedure for the most part. Again, a lot of people died. And so they started moving more toward things like exorcisms. And an exorcism is where you coax the evil spirits out of the body, and usually done with an old priest and a young priest, right? If you watch horror movies, which I love to do. But exorcisms work off the idea that somebody is acting oddly because they're possessed. And really, as long as you go back, there's debates about, is it possession or is it mental illness? And this is something that pops up in a lot of horror movies. Is somebody possessed or do they have something like schizophrenia, which causes them to have bizarre perceptions and ideas about the world. And I found a cool clip from a movie called The Right. It's an older movie, but there are a lot of films featuring this theme. I put just a few of them up here. There are way more, but a lot of movies featuring this theme of like psychology versus religion. And it kind of depends on which lens you're looking at it through. As I mentioned, some people still practice exorcisms. And in theory, if you believed that you were possessed, then some kind of like ritualistic exorcism might work. It's kind of like that placebo effect, right? Like if you think you're possessed and we perform a ritual of sorts, like an exorcism, you might think that you're better. But again, this theme of like psychology versus religion comes up a ton. And I found a clip of it. It's nothing scary. So if you don't like scary things, don't be afraid. It's more of just like a debate, but I think it's through, and they talk about viewing it through the lens of faith. We're viewing our stuff through the lens of psychology or the lens of science. So we're going to err on the side of like mental illness. But if you're a religious person, you might believe in exorcism. And again, they are still practiced today and featured, as I said, in quite a few scary movies. I don't know, any thoughts or comments about exorcisms and trepanations, right? If you watch any of these movies, it's a theme that comes up a lot. I'm waiting for The Conjuring 4 to come in, right? I'm such a big fan of that universe of films. All right, huge shift came after that. So we have mental illness as the result of like possession, right? Supernatural elements. And then if we look at a different take, the Greek and Roman views were almost like a polar opposite. And you see this so much in psychology, right? We have all these different theories and lenses and ways of viewing different things. And so what we get here is a shift to philosophers and physicians, right? And so we get people like Hippocrates, who's sometimes called the father of modern medicine. And he was the first one to say, well, maybe mental illness has a physical cause. So rather than being supernatural or spiritual, he proposed that it was physical, something natural and within our body. Very different model, very different perspective. And Hippocrates talked about what he called the humors, that everybody possesses 4 different fluids that flow throughout our body. And these fluids should be in a natural like balance or proportion. If they get out of balance or out of proportion, then they can cause issues like mental illness. And the 4 humors or fluids that he came up with, funny to think that these are our fluids, right? There's not a lot of scientific evidence to back this, but it was an early idea. Yellow bile, black bile, blood, and phlegm. Phlegm like snot, right? Like phlegm like when you're congested. So bile is a fluid produced by the liver, and then blood and phlegm. And the idea behind this, if you pull blood out of somebody's body and you let it sit, it separates into a couple of different layers. Usually we talk about 3 layers. He added a 4th. Okay, so forgive me, I'm not very artistic in the slightest, but like if you took like a little like vial, like a little beaker, I mean, it could be worse, right? My kids know better than to ask me to draw anything for them. They're like, no, I'll ask mom, right? Please. So if you took blood out, you let it sit, it's going to separate into 4 different layers. So at the top, we have the yellow bile. And the yellow bile, right, is basically like the yellow serum or plasma in blood. Right, if you want to look at what it would actually correlate to. And people who have too much yellow bile, he thought would be like overly frenzied, like maybe what we would call manic now, right? Too much energy, too like out of control, hyperactive. And, then underneath that, we have the phlegm. And the phlegm, if we want it to correlate, it correlates to the white blood cells. And if somebody had too much phlegm, we would say that they were overly lazy. And each one of these also then had a treatment that went with it. And that you don't need to know what those are, but just as a side note here, if somebody had too much phlegm, the treatment was therapeutic vomiting. right? We make them vomit until their phlegm levels go down, right? By giving them different herbs and mixtures, right? So for every different type of fluid, there was a treatment to try and get it back into balance. Underneath that, we had blood, which would be the red blood cell. And if people had too much blood, for example, they were overly cheerful. That doesn't sound so bad, right? Like being overly cheerful, but it could be problematic, right? And so for this one, they would do things like bloodletting, putting leeches on people, or like removing the blood from their body, which is a very dangerous thing to do. But again, trying to look at natural causes and physical elements to mental illness. And then at the very bottom, we would say this is the black bile. And it was just kind of like a dark layer at the bottom. It doesn't correlate to anything that you would actually see. Typically, blood just kind of separates into these 3 layers. But he talked about 4. And he also talked about the relationship to personality. So if you ever take like a personality theories class, the same idea would come up, that your levels of these different humors could also influence your long-term like personality as well. But for our purposes, it was more mental illness. So just a big shift, right? We go from supernatural to physical. And then we go back to supernatural again, right? And again, constantly, you see these changes in psychology. So if we go looking at like Europe in the Middle Ages, this was a period of time that was very, very dominated by the church, right? A lot of power of the church and the clergy, especially in Europe. And in this case, we say that any kind of mental illness is the result of Satan, not evil spirits, but Satan, the devil specifically. Right? So we kind of take it up a notch a little bit here. And at this time, we started to get some really bizarre methods being invented, right? Kind of unpassable tests, if you will. And this was a period of time where we saw things like the witch hunts and a lot of like things along those lines. And so what you see in this image here is they would do these tests, and you see this a lot in movies as well, where they would put a woman, typically women here, in the water. If they drowned, they clearly weren't a witch, right? But they drowned, right? If they didn't drown, they were a witch, and then they would kill them. There was no way to win that scenario, right? But these were women who oftentimes like were having bizarre ideas, maybe things that we would see now as like schizophrenia, like. But we see that it was the result of Satan, more exorcisms and trepanations, and then we kind of make another shift after that. But a big role of the church in seeing these situations where people really couldn't come out on top, in a sense. The Renaissance came up with a new idea, a really brand new, positive, progressive idea, right? This man named Johann Weyer, Dr. Johann Weyer, came up with the thought that what if people who are struggling with mental illness need a break from their life? So let's take them out to a nice big country house and let them rest and recover. And then when they're better, we'll put them back out into the world. And these big country houses that were supposed to be these beautiful, calm, relaxing places were called asylums. Now, when you think of an asylum, you probably don't think of a nice, bright, pretty, relaxing country home. What comes into your mind the second you think of like an asylum? What do you picture? What are some of the things that you see? Yeah. Yeah, exactly. Or what else? What else do you like? What comes to your mind? What are like associations with asylum? Yeah.
Some hotel kind of building.
Okay. You think of that? Interesting. Okay. Anybody else? Images or like associations?
Think of American Horror Story.
Yeah, season 2. Right?
Favorites.
Oh, me too, by a mile, right? I haven't seen the new. I stopped at like season 7 or something like that, but yeah, that one, right, where like awful conditions, right? You don't picture happy, like clean, productive things. You picture probably dark and dirty, people dying and rotting in their own filth, right? Bizarre and cruel treatments, electroconvulsive therapy later on, right? But the asylum was started with these really good intentions. It was supposed to be something really nice and positive, but we had no idea how to treat these people that we were putting away. And you could be put away for literally any reason. And so as a result, people rotted in their own filth. They just became like jails in a sense. Yeah.
If I'm remembering correctly, the word asylum is supposed to be like
Yeah.
sanctuary.
Right.
So the modern like implementation that ideas they have of asylum are actually, that is what's inconsistent with what the
Yeah.
word means and what they intended, the purpose was.
I love that, right? And that's a perfect point. That's what he meant for it to be, like a safe place, a sanctuary. And it was anything but, right? These were awful places and people rarely came out of them alive, let alone better off. They did things like these restraining cribs, right? They would put people in these cribs and lock it for days in order to confine them. They would spin people in chairs until they vomited and passed out. They would bleed people with leeches. I mean, just we had no idea how to help these people who were in these asylums. And there was no funding and no support. It was a very, very dark, dangerous, like scary time to be struggling with something like a mental illness. And on top of it, you could be put in these for any reason. A husband could put his wife in there for not having sex with him, right? Or being, spit out your water, right? Right? It's just, it was shocking. You could go complain and have someone thrown in there for no reason whatsoever. You see that in American Horror Story season 2 as well. And that's very, very accurate. So out of this time, we get a lot of like huge, massive asylums. These were popular for years. And the most famous, or we should say most infamous, famous in a bad way, of these asylums was a massive one in London called Bethlehem Hospital. Now, Bethlehem Hospital was this absolutely mammoth building, just huge. And you saw this with the asylums, they were massive. And with this one, it has a really interesting history. Bethlehem transitioned over time to Bethlehem, and then it later became known as Bedlam. And this place, instead of Bethlehem Hospital, became known as Bedlam Hospital. Bedlam translates to chaos or madness, right? And it became synonymous with this location of people who were lunatics or people who were mad being locked away. And I found a little excerpt from a documentary where they kind of show you some images and like the size of this place. It's only like a minute or two, but I thought it was interesting, so I'll share it with you. But this was probably the most infamous of them, but they were everywhere, right? This being one of the biggest ones. Let me play this for you. Oops, I'm just clicking buttons now, thinking about roles. As I mentioned, a lot of them just got shut down and converted as we switched ideas and switched philosophies, starting in like the 80s and 90s. It just fell out of favor to treat people in these massive buildings. Instead of removing people from their lives, and then when they're better, putting them back, we had other thoughts, right? Kind of some current trends that we practice instead, because there were a lot of issues with locking people up, right? By removing people from their lives, they'd get better. But the second you put them back in their life, they'd relapse again, right? So instead of that, some of the things that are really big in the field right now, or over the last like 10, 20 years, are things like medication and private therapy and prevention and so on, right? We use a lot of medication when it comes to treating mental illness, maybe too much medication, right? We could debate that a little bit when we get to that. But we have a medication for every mental illness and then pills to help counter the side effects of those medications, right? There's a lot of side effects that come with these, but they can be game changers for people at the same time. So we'll talk about different medications all the way through as we get to the disorders. This is a huge trend in our culture, right? Having psychotropic or medications to help deal with symptoms of mental illness. We also like to treat people more in like the community and things like private therapy rather than locking them away. Private therapy is the norm where you meet with like one therapist and it's therapist and client, right? And you go and meet with them weekly or in whatever arrangement you have, providing counseling services, or maybe it's group therapy, but instead of putting you away in some big institution, private therapy is really common. And over the last 3 to 4 years, especially since COVID, a lot of like cyber therapy, people meeting with therapists virtually or just over the phone. This has become very, very common. My daughter, one of my kids, has cyber therapy. It's so weird because I think it feels like a video game to her, right? Because it just seems like she's watching a movie that's interacting with her. But it's so strange, it's just like the norm now. Like when we tried to get her into counseling, it was like, well, she'll meet with someone virtually. And we're like, well, we want her to meet with someone in person, and it wasn't even an option, right? Just meeting with people virtually. But therapy is very, very common. Right? It's probably that and medication together are the two most common ways that we treat mental illness. Now, right, and therapy was something that was invented by Freud. And we'll talk about that a little bit when we get to the models next week. But we focus on that, we focus on prevention, trying to identify and catch things before they can develop. What are some of the warning signs, and how can we catch things early? So these are some of the, like, the big things that we do now. There's also kind of a debate, just as there's a debate on, you know, what is abnormality, and there's a debate on what is treatment. There are as many treatments as there are like ideas on what is normal and abnormal, right? There are so many different types of treatments that we'll talk about this semester. And we just have like a general guideline for how do we decide if something qualifies as a treatment. And this is really, really general, just like the ideas about abnormality are kind of general. But according to this man named Jerome Frank, a clinician who did a bunch of research trying to like get a meta-analysis of what do we qualify as treatment. Treatment has three components, right? Someone who's suffering, who seeks relief from a healer. Suffering could be emotionally, it could be behaviorally. We kept that really broad. A healer could be a medical doctor. It could be a priest. It could be a psychiatrist, a psychologist. It could be anyone that you deem to be a healer. And that's what's number two. That socially accepted healer is someone that you view as someone who could help you. So maybe when you are struggling, you think your medical doctor is your best bet, or your spiritual advisor, whether that's a priest or a shaman or a rabbi or whatever it might be. And then you have a series of contacts between the person who's suffering and the person who is a healer with the hope of getting better. So there's just as much disagreement here as there is about what's normal versus abnormal, but a ton of different types of treatment, from different types of therapies and medications and procedures, things that we'll talk about all semester long as we go through the different mental illnesses. Questions, thoughts, comments, anything at all? There's a few more things here, but anything at all for the moment? I think I asked you last time, but anyone in here, and I don't remember, so forgive me, I'm pretty sure I asked, but how many of you are considering like one of these careers? Like maybe thinking about it, right? Anyone want to share? What are you thinking? Know any ideas of what you're thinking of doing at all? Yeah. School psychologist? Amazing. Anyone else? Yeah.
It's school psychologist and social worker.
Okay. Yeah.
I'm interested in psychedelics.
Okay. Like I want to be taking them or administering them, right? Right. I'll just be both. Right. So like as a therapist and administering them. Okay. Love it. Right now that's something that controversial, but a very popular thing right now to explore, the things like ayahuasca and things like that. Yeah. Okay. All right. Love it. Anybody else? Yeah.
I don't know a whole lot about it yet.
Okay. All right. Wonderful. Right. So popular, right? CBT is huge right now. Anybody else? Not gonna like mark it down and hold to it forever. You're welcome to change. I thought I wanted to be a therapist, and then I ended up being a professor after doing therapy for a while. Like you can always shift, but there are just so many different professions that you can have in the field of abnormal psych, right? They're very degree dependent, right? So unfortunately, you need typically a master's or more to be able to do any of these things. But hopefully, if it's something that interests you, like, you know, you're learning a lot and that makes it more interesting along the way. But we'll talk a little bit about some of these different professions. Before we do, there are a lot of stereotypes about therapy and therapists and people who go to therapy and just therapy in general. And I'd like to kind of take a minute to get some of those like down and out, right? Because there are so many of them. So what I want you to do, you're not turning this in, it's just more for discussion. Find a few people around you and have somebody write it down so you can share. But what are some stereotypes that either you have or you've heard about therapy, therapists, people who are therapists, people who go to therapy, therapy in general, anything related to like therapy and therapists? What are some associations or thoughts? Like, for example, My instant one, the second I think of therapy, how does that make you feel? Right? That's my first stereotype that comes to my mind. Something they would say. Might be something they say, they would do, they would wear, the person, anything. So find a few people and I want you to just kind of jot it down so we can share it. I'll give you a few minutes and then we'll talk about it together. So just whatever's convenient around you.
Yeah.
But I'm finding this important. Nikolaj. Yeah, and like the brand. I don't need to. You got one poker. Were you in there? You know what I mean? That's what I'm thinking. We're thinking about the asylum, or thinking about, did you build?
What?
In chunk of. Yeah, it's all about leading. Talk about it and then start. Around, and then it all makes sense with the young. She was talking about.
Yeah.
It is. They're always.
I'll give you a couple more minutes and we'll talk about it together. A couple more minutes. Yeah.
I think they build an open.
It's like, I think sometimes it's like. Yeah, they're not. That, but.
But blood one, or it's just like you evolve and it's just one?
Yeah, yeah.
I have to run it through because at this point I've already explored it, so you go to the cans. Yeah. You, right, then there's like training.
All right, I would love to hear what you came up with. What are some of the thoughts or images? What comes to your mind when you think of therapy or therapists or whatever? What did you come up with? Give me one thing. Yeah,
Is thing in the room with us right now.
uh-huh.
That's another line.
What was that?
Is thing.
Okay, so that specific line. Okay, other people, what else did you come up with? I heard a bunch of I heard somebody say it like right off the bat, the couch, right? Right? There's that horribly uncomfortable couch. Freud is the one who invented the idea of the couch. But there's gotta be a couch in there. If you walk in there and they don't have a couch, turn around again. Right, what else? Like things they say, they do, what else did you come up with? Yeah, sorry.
One stereotype we came up with, but one that I wasn't expecting to find was the perspective that therapy is a cure-all, that it is a miracle cure guaranteed to absolutely fix you.
Okay, and that'd be so nice if that were true, right? If therapy was fast and guaranteed to fix you, but sadly, it's really slow. And it's not guaranteed, right? But yeah, that is a really common one. What else? What else? Yeah.
Saying how there's like a stereotype, there's more women in therapy than there's men.
Mhm.
Like society expects women to go into therapy, but react a certain way and they're more emotional, more like whatever. But you don't really care a lot of like men talking about going to therapy, even if they aren't. It's like stigmatism around.
Yeah, for sure. I like that you came up with that, right? There's a lot of stigma around therapy, right? And I won't ask you to admit this, but because there's so much stigma, like I would never ask you to admit how many of you are in therapy, right? Because it's just something that people tend to feel really embarrassed about. There's a lot of stigma related to it. I have gone to therapy once a week, every week for like 5 years or something at this point. I believe in therapy. Like I think it's something that could benefit anyone and everyone. It's just somebody to talk to. I mean, yes, they're charging you or charging you insurance or whatever, but like it's just like a neutral party that you can talk to. But that's not the main attitude toward therapy. I don't think that people are embarrassed about it or think it's worthless. There's a lot of like beliefs or yeah,
I have two things.
yeah.
First of all, it seems like mental health is hot now. So like if someone says, "Oh, I did therapy," I'm like, damn, I did therapy. That's crazy.
Yeah.
I've had
So I just gained like points. By
yeah, exactly.
I'll take it.
I've had, this is not the second thing, but I've had someone like, I'll be talking about my feelings or not, and be like, it seems like you go in there. Like, and then,
Excuse me?
no, just like the way you talk, it seems like you think about things, and I'm like, cool, whatever. But the second thing was something my grandma told me, because I was talking about therapy, and she was like, well, just be careful, because usually those psychologists, they have something wrong with them.
Yeah.
Yeah. The way I look, first of all, I was like, okay, what the fuck, everyone does. But then, second of all, the way I look at it is, yeah, I would want a healed person to teach me how to heal myself, not someone who's never been sick before.
Yeah. And you know what? That is such a common stereotype, right? That therapists have baggage themselves. And it's often true, right? A lot of people who go into psychology, sorry, we're all like in an abnormal psych class. You gotta be a little bit like, you gotta have a little bit of baggage yourself, I think, a little bit of crazy to go into psychology. Hopefully not too much, or you can't do your job, right? But I think a little. And sometimes therapists go into it because they had issues too. I have to tell you in the beginning of therapy with my therapist, I was trying to figure out her issues. But like based on her background, so like, she's like, I'm an attachment specialist. And I'm like, you see what attachment issues you're trying, like, imagine that, like, I'm trying to figure it out. Because typically people who are in that field have at least gone through something. Or maybe they're just really like caring and empathetic, and that could be the case too. That's a really common one. And we were talking about stigma. I heard you talking about it. It's a lot of cultural stigma around therapy. Anyone, any thoughts on that, like cultures or ethnicities and like beliefs around therapy?
I have a lot of family in the South.
Yeah.
in, like, Bible Belt area, so there still is that idea of like, well, you just haven't prayed hard enough.
Okay.
You know, or like, just, why are you telling a strange person
Yeah.
your problems like that much?
A strange person or even just a stranger, right? If you just pray hard enough, it'll go away. It's like the old Saturday Night Live skit of just stop it, right? Like just stop. Like you're depressed, well stop it, right?
Yeah.
Like that'll be $100, right? Like so many ideas like that though, right? Why would you talk to a stranger? Well, why would you go? Like, yeah.
Yeah, back up, like the religious thing, like, I have a family member who's like, oh, no, that's just a demon. You just have to get rid of that, like, give that's God.
Okay.
And I'm sure God can do a lot for you. I don't have anything to say like God's not real and whatnot, but, my mom was actually talking to this relative and was like, or there's like something wrong with me in my brain that I need to work through.
Yeah.
And they're like, yeah, I get it.
50-50, right? Yeah, but like that religious belief or cultural belief, a lot of like ethnicities and cultures have strong beliefs. My partner's family is like very Catholic and Hispanic, so I go over really well with family, as you can imagine. Their traditional Catholic family, they were like, wait, like you're marrying that? Yeah. Yes, that's me, I'm that. That's right. But whatever, I don't care, but it's just like her whole family would never consider therapy, even my partner. I'm trained as a therapist. My master's is in counseling psych. I go to therapy. One of our kids is in therapy and she is totally anti-therapy, right? Because of her cultural beliefs. Yeah.
And so they just don't believe.
Yeah.
They think like there's nothing wrong with you. They straight up, there's no way that anyone can be mentally ill and they're mentally.
Yeah.
And it's not like something that can change their idea. They just,
It's entrenched, right? It's just a cultural value. Yeah, like you don't go, there's nothing wrong with you, right? That's not uncommon. Yeah.
But my family that's still there, they all, it's kind of like the same way that she was saying, it's very much, oh, you're in our family, you can't have anything wrong with you, because
Sure.
you're gross, like you're not part of us, you're not real, then you don't belong to us. And it's like, if you admit to like needing help, and it's very much, okay, you're weak, you're not part of us,
Yeah.
we'll like disown you. But I think it's very much like keep your issues to yourself, or you just don't have issues.
Right. And then you contrast that with like therapy being something that is, I think, much more culturally accepted now, puts a lot of pressure of like, you can't have anything wrong. You can't go get help. Right. There's a lot of like battles between that. A lot of people struggle with the idea of going to therapy. And I always like to admit that I go because I want to normalize it. Like it's something that I think can be helpful to anyone. But any other stereotypes? What is do you picture anything else in the room other than the couch? Like anything else in the room that comes to mind? Yeah. Yeah, they're taking notes, right? Always taking notes, just and nodding. Like a little bobblehead. Right. How does that make you feel? And then the follow-up to that is tell me more about it. Right. That's the follow-up to how to get it. Right. Just a side note. Anything else you picture in the room besides the couch and the taking notes?
An old white man.
An old white man, right? My therapist is an older white woman, right? But old white person, right? Yeah. White curtains. Oh, you went the, I like that. The white walls, white curtains. Yeah. Yeah, I see those. Yeah, potted plants, like a little, I picture debris on the wall, right? Some kind of like rock garden or fountain of some sort of little tissue boxes. It's gotta be tissue boxes because you're gonna cry, right? Definitely gonna cry in there. Anything else that you think of? Anything else related to therapy? People who go, anything at all?
They have good will hunting.
Goodwill Hunting, yeah, right, for sure, right? We're gonna hug it out and cry angrily, right?
That was a great movie though.
It is a good movie, definitely a good movie. Great portrayal of borderline personality disorder as well, right? Anything else? I have one more because my therapist says it every week and I roll my eyes at her every week. She always says, don't forget to practice self-care. I'm like, self-care. But so one week I told her, how about self-cake instead? And she's like, what does that mean? And I'm like, I'll go get a piece of cake as a form of self-care. And right, it makes me happy. So I'll go get a piece of cake. So now every time she's like, don't forget to practice self-cake. After 3 years, I converted her. Now it's self-cake instead of self-care, which I'm happy to practice self-cake. I sent her a message like was like 2 months ago. I had 2 cakes in one day. I was like, I really crushed self-care today. So, that's one that comes to my mind, self-care, and then all the things that you mentioned. As a side note, how many of you have heard the term shrink before? Right? So shrink is a really common, like stereotypical name for a therapist. It originates from head shrinker, right? That's where the term comes from, and is a reference to the process of shrinking the heads of your enemies, right? So that's kind of, I think, summing up our cultural beliefs of therapy, right? Shrinks are shrinking your heads like a tribal practice that used to be done to enemies, but a lot of mixed ideas. So I wrote this little chart up here. If you want to copy it down, or I'll leave it if you want to take a picture at the end. I know sometimes it's hard to see. Oops, let me find it here. So differences between these: clinical, counseling, and psychiatry, right? Anyone know what the biggest difference of a psychiatrist is? Yeah.
Isn't psychiatry primarily concerned with medication?
Yeah. So psychiatrists have a medical degree. And their focus is on prescribing medication. Very different than the other two. Right? A counseling psychologist, in terms of education, typically has a master's degree, which is on average 2 years, right? I have a master's degree. I have a master's degree in counseling psychology. Typically, someone who has a master's degree would be what you would call like an MFT in California, a marriage and family therapist, versus a clinical psychologist typically has a PhD, which can be anywhere from 5 to 7 years, right? And these 2 or 5 to 7 years don't include all the internship hours that you have to do as well before you can take your licensing exam to get licensed to do that work. The focus: counseling psychologists deal with more like everyday problems. Depression, anxiety, relationships, like kind of more typical stuff, right? Like everyday things that people are struggling with. Versus clinical psychologists who have more education deal more with disorders. Now, that's not to say if you go see a marriage and family therapist that you don't have a disorder, but typically clinical psychologists deal more with like assessment and diagnosis. They might work with people who have more severe mental illnesses. So there's a little bit of a difference in the population that they see. And psychiatrists focus on medication. Okay, so a couple of kind of little differences here. An appointment with either of these individuals is typically 50 minutes. And they use a variety of like techniques or like talking and so on. Right? So maybe it's talking through issues that come up. Maybe it's behavioral kind of stuff, depending on their approach and their model. We'll talk a lot about the models next week. Psychiatrists see you for a much, much shorter time, typically 20 minutes. And their focus is on the medication, like symptoms and side effects. So typically when you go to see a psychiatrist, how are you doing? How are you tolerating the medication that you're on? Tell me a bit about how you're functioning. It's quick. It's a 20-minute appointment, sometimes less. So it's really common that someone sees a psychiatrist and a therapist, right? Especially if they have something that like they're taking medication for that mental illness. They might go see a psychiatrist to monitor the medication and then a therapist to work through the issues that they're on medication for. And they can coordinate with each other. Really, 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 really common. Last piece, and this is in California in 2019. So a few years old, right? So probably find newer information. On average, someone with a counseling psychology degree makes about $95,000 a year. Now that's an average. I have a friend who counsels with a master's degree in Agora Hills. So he works in a very rich area. he sees people on the weekend and in the evening, and he makes like 150 a year. I asked him, he didn't mind telling me. So this is an average, depending on how many clients you see and if you have a specialty area. Clinical psychologists, on average, make about 110 a year. You'd hope you'd make more, right? You have more student debt, student loan debt to pay off after 5 to 7 years. So making a little bit more. Psychiatrists, you ready to change your career path there? 250,000 a year on average. Anyone like, I know what I want to be, right, when I grow up. They make a lot more money because they are prescribing medication. It's a lot more like responsibility. Now, there you can also be a school psychologist, which typically requires a master's degree. And then you're working in school settings with like testing and diagnosing. Social workers have a master's degree as well. And clinical research is typically a master's. So in general, you typically need at least a master's in order to do this work, sometimes even more. Any questions or thoughts about these career paths? Anything here? Yeah.
I think that if you get like your MFT and or your, what is it, MSW, you can segue into the school setting. But if you only do school psychology, you can't veer outward. So
Yeah.
I'm trying to decide which one is better.
So typically, so I know for like the college I went to, their masters in school psychology and the masters in counseling, we spent the first year together and then we split and like focused on our areas. So maybe one extra year and you could even have both. A lot of people will double masters as a way of kind of being able to do both positions. Anybody else? Any other thoughts or questions? Yeah. Yeah, so forensic psychology usually requires a master's as well in like forensic psych, and you can do profiling and all sorts of things related to that as well. That's our last unit. So we'll talk about that at the end a little bit as well. And I wrote that up here, apa.org. It's the American Psychological Association site. Has like a lot of awesome information about like what you need to do and what the differences are and training and education and stuff as well. So I'm going to stop there. I'll give you a moment if you want to pack up and then I'll take attendance and we'll be done for the day and done for the week. Okay. It's crazy. Can you imagine if we only had school 1 day a week every week, right? Yeah. Yeah, so just read chapter 2 or like look over chapter 2. That's what we'll start on Monday. We'll start looking at the models of admin. And that's it. And I'll leave this up here. If any of you want to take a picture of it, I know that it's kind of hard to see in the back, so I'll leave it up.